it is very important to understand about medication errors, right? The main clinical role of the clinical pharmacist is to optimize the therapy by limiting the drugs or by limiting the medication errors. Medication error concept is very important for family doctor. This is very, very important. Before that, see, medication error is possible from diagnosis. It starts from the doctor. Medication error starts from the doctor. It starts from the diagnosis. When doctor diagnoses the condition as wrong diagnosis, from there medication error starts. First of all, let me explain you what is medication error. Medication error is nothing but it is a preventable error. It is a preventable. See, we have so many errors in our life. We have so many errors in our daily activities. We keep doing. It is very common. Being a human being, it is very, very common. For every perfect human being, there will be certain disorders and there will be certain errors. Jitna bhi perfect ho, definitely being a human being, we will be doing some errors. So in medication also there are some errors. So medication error is nothing but it is a preventable error which is seen especially in patient who is taking drug or when a patient is on treatment. When a patient is on treatment, in that cases, if any error occurs which is preventable, that is called a medication error. So medication error starts from the diagnosis from the doctor. If a patient is known case of diabetes mellitus, he is a known case of diabetes 1 and doctor diagnosed the patient as DM2, that is medication error, because here the patient will be treated with type 2 diabetic medications whereas patient was diagnosed with DM1. So the medication error will start from the doctor and it will end with the patient. See, medication error is possible with the doctor, it is possible with the clinician, it is possible with the nurse, it is possible with clinical pharmacist. Medication error also can be seen with the patient. So all these people who are taking part in the treatment of the patient, who are involved in the treatment, they are all responsible for medication error. So to optimize the therapy, it is very important, particularly for clinical pharmacist. Okay, clinical pharmacist is the person who tries to decrease the medication error. So I will try to explain you the roles and responsibilities of a clinical pharmacist, how many types of medication errors we have. Okay, all these things I'll try to explain you in detail. Okay, it's going to be 30-35 minutes of lecture, so everybody try to concentrate. Okay, now you see, we have understood what is medication error, because it is a error that is seen when patient is taking drug or when patient is taking treatment, right? See, medication error starts from the doctor, I told. Here in medication error starts from the prescription. There may be some prescription errors. Doctors will make certain prescription errors. Doctors may prescribe wrong drug. Doctors may prescribe wrong dosage. Doctors may prescribe wrong dose. And doctors also may prescribe wrong frequency. So these prescription errors are, first of all, it is identified by clinical pharmacist or dispensing pharmacist, because prescription will be taken to dispensing agent, dispensing pharmacist, and dispensing pharmacist will try to find out these errors. So the errors which are seen in prescription are called prescription errors. It will be seen in prescription, and then if prescription is not transcribed properly by the dispensing pharmacist, again the dispensing pharmacist will make another mistake, that is dispensing error. So wrong dose will be prescribed by the doctor and wrong dose will be dispensed by the pharmacist, and wrong dose will be taken to the again to the patient, and patient will take the wrong dose and it will be administered by the nurse. And here nurse also should try to optimize the wrong doses. What nurse does, nurse has no knowledge about the dosage form and about the dose calculation. So nurse will directly give the dose which is prescribed by the physician, which is dispensed by the pharmacist. So wrong dose will be administered by the nurse and wrong dose will be wrong medication will be taken by the patient, and it may cause two things. When patient is having medication error, it can cause two things. Number one, patient's treatment may go to excess dose or dose toxicity. When patient is taking the drug, two things are possible. In that, the first one is it may cause dose toxicity or drug toxicity. Second, it may cause subtherapeutic level. Subtherapeutic level. See here, listen carefully. When patient is taking the drug, there are two things possible. When excess dose is taken by the patient, it may cause toxicity. Lethal consequences can be seen with the drug toxicities, and it may also cause adverse drug reactions. Number one, and number two, it may cause subtherapeutic. It may go to subtherapeutic level, and it will cause treatment failure. Treatment failure. So two things are possible when drugs are given to the patient. One, it may cause toxicity and it may cause treatment failure. So here, the clinical pharmacist, what clinical pharmacist should do? Clinical pharmacist should try to identify the exact dose by identifying the patient's parameters like patient's gender, patient's clinical kinetic parameters, how the drug is taken either by oral route or by IV route or through any other route. Okay, so it is very important for the clinical pharmacist to identify whether the drug is showing toxicity or the drug is showing subtherapeutic action. Now let us try to understand the different types of medication errors. I'll be discussing different types of medication errors. In that, the first one is untreated indication. From here, everybody should concentrate. I think most students are my own students. First, very important medication error is untreated indication. What is the meaning of untreated indication? Untreated indication. Already patient is having disease and this disease is not treated. For example, a patient has diabetes mellitus and patient has hypertension. Patient is already been diagnosed with diabetes mellitus and patient is diagnosed with hypertension. But the physician, what physician does? Physician will avoid the patient's blood pressure and physician will only focus on the patient's RBS value or drug, other diabetic profile. And with this, the physician will prescribe the anti-diabetic drugs. Only anti-diabetic drugs will be prescribed in this case. So here, drugs like we have oral hypoglycemic drugs, we have insulin therapies, okay, we have novel therapies. Anyways, when diabetic treatment is given and hypertension treatment is avoided, that becomes untreated indication. So here what we have to do, it is very important for the clinical pharmacist to identify different disease conditions. And these disease conditions, we have to identify whether all disease conditions are treated or not. For example, patient will be having different disease conditions. Patient has asthma, patient has diabetes, patient has hypertension, patient has some other condition like thyroidism. So for each condition, it is very difficult for the physician because for asthma, pulmonologist will prescribe drugs, and for diabetes mellitus, endocrine doctor will prescribe drugs, and for hypertension, general medicine doctor should prescribe, and for again thyroidism, endocrine doctor. See, for treating the patient, there are different specialized doctors. So in these many conditions, patient is already having these conditions, but in this case, see, asthma patient is not taken to pulmonologist. So what will happen? It becomes untreated indication. In that case, in untreated indication, what happens? Patient will be taking treatment only for one condition, and the remaining condition will not be treated, and this remaining condition will go to complication, and that will again cause lethal consequences to the patient. I think you all are understanding what I mean. Okay, untreated indication is that where patient will already have diagnosis, but that condition is not treated by the medical professional. Okay, that is called untreated indication. So untreated indication hota hai, it is possible in the hospitals. It is very common in the hospitals. When we go to hospital in the wards, when we try to evaluate the cases, patient will tell that I am having abdominal pain, and for abdominal pain there are no drugs prescribed. Patient says I am having shortness of breath. In that case, there is no drug indicated for shortness of breath. So like that, there are different disease conditions where patient is not treated. So that is called untreated indication. I think you all understood what is untreated indication. Okay, now let's go to the next one. The next is inappropriate drug selection. This is very important for the clinical pharmacist to understand. So inappropriate drug selection में क्या है? A patient is having hypertension. I will try to explain the same. Patient is having hypertension, and in hypertension, ACE inhibitor is prescribed. But patient is already having dry cough, and ACE inhibitors can cause dry cough. So here, ACE inhibitors are not good choice. So this type of medication error is called inappropriate drug selection. Clear, everybody? It is very easy. And let me give one more example. See, I will try to give one more example so that you'll understand. The patient is having congestive heart failure. Patient is a known case of hypertensive. Okay, and patient is having edema. In this condition, see, we have to treat or we have to control patient's edema. We have to control patient's blood pressure, and also we should try to control the patient's congestive heart failure. Okay, and we should try to decrease the further complications of these all conditions. So in this case, one physician says that for hypertension I'll go with CCB, And for edema, I will go with thiazide diuretic. And for congestive heart failure, I'll go with digoxin. So like that, if they give this type of prescription, what we should try to do? So these all these conditions are all these drugs are not appropriate. So here what we can do, here paid for hypertension, we can prefer ACE inhibitors here, because ACE inhibitors are effective both for congestive heart failure, for edema, and also for hypertension. So one ACE inhibitor plus one loop diuretic we can go. Loop diuretic we have Lasix, or we have furosemide. Okay, so loop diuretic can decrease patients' edema. It can also prevent patients' hypertension, and loop diuretics will decrease the load in the patient, and through that we can restrict congestive heart failure condition. So here the best choice is not CCB, but best choice should be ACE inhibitor plus diuretic. So see, this is just an example. This is not applicable for each patient, all the patients. We have certain guidelines for treatment, okay? And all guidelines are not suitable for every patient. It is specific for specific patients. Depend on the patient's condition and depend on the scenario, we have to choose the drug. So here in this case, better, see, CCB say better, here we have ACE inhibitors. Okay, so like this, we have to choose the patient's treatment chart. So this is called inappropriate drug selection. So in inappropriate drug selection, clinical pharmacist plays a very important role. Okay, so this is also one type of medication error. So in this medication error, how we can prevent this? By selecting the appropriate drug to the appropriate disease condition. Okay, that is one type of medication error. And next, we have subtherapeutic doses. This is very important. Another medication error which is possible due to subtherapeutic dose. See, to treat the patient or to perform the pharmacological action of the drug, definitely we should try to show the therapeutic dose, or we should try to maintain the serum drug concentration. Okay, for example, this is blood. In the blood, if specific serum drug concentration is not available, these drugs will not show therapeutic activity. See, we have some narrotherapeutic drugs. In narrotherapeutic drugs, this subtherapeutic dose probability is very high. So in that cases, I will try to explain with certain examples also, try to understand this subtherapeutic dose. This is very important. Okay. See, I will try to explain with one best example. I think everybody are following me, right? Yes. For subtherapeutic dose, we have so many causes and so many risk factors. In that, first risk factor for subtherapeutic dose is, first of all, prescribing the low dose. For example, see, in pediatric patients, if you go to the hospital for certain infections in pediatric department, for example, amikacin is prescribed. Okay, amikacin is the aminoglycoside antibiotic. See, the normal dose of amikacin for 1 month baby, one complete 1 month baby who is having, who completed the term, okay, who completed the term and who is having 1 month age, in this baby, 15 mg per kg per day is the standard dose. ध्यान से सुनो, everybody should concentrate. Amikacin is the aminoglycoside antibiotic, very important narrotherapeutic drug this is, and it is having many lethal consequences, lethal adverse effects also. So this aminoglycoside, the standard dose for 1 month baby is 15 mg per kg per day. This is the standard dose, and in the prescription, the physician or the pediatrician has written, correct only, physician has written 7 mg per kg per day, and this is written BD. Actually, for 24 days, sorry, for 24 hours, we have to maintain 15 mg per kg. For example, if patient's weight is 10 kg, and our dose for 24 hours will be 150 mg. For 24 hours, we have to give 150 mg. Here what happens? The physician has prescribed 7 mg per kg per day. It should be given BD, but here the physician will write OD. What will happen? Actually, the physician should write BD, but he has written OD. So the same drug will be given, and the common dose here is 70 mg per 24 hours. The 70 mg is not sufficient to fight with the infection, and this is called subtherapeutic dose. So first cause for subtherapeutic dose is directly prescribing wrong dose or directly prescribing low dose to the patient. Clear? And second cause, you see, second cause for causing subtherapeutic dose, we have drug interactions. See, we have certain drugs which are called enzyme inducers. I think you might have heard about enzyme inducers. Crab GPS. If you follow my YouTube channel, you will find all these. Okay, Crab GPS. This is the synonym for enzyme inducers. See, C means here we have carbamazepine. Carbamazepine. So this carbamazepine is very very important enzyme inducer. Let's take one example for subtherapeutic dose. Okay, one best example for subtherapeutic dose. There is one drug called warfarin. Warfarin is very commonly used for different deep in thrombosis and for coagulability, hypercoagulable conditions. Okay, for stasis and for many conditions we use warfarin. So warfarin 2 mg, just imagine warfarin 2 mg is given, and along with warfarin there is carbamazepine. Carbamazepine is also prescribed along with warfarin, and here patient is also taking rich sources of vitamin K, vitamin K rich sources. We have green leafy vegetables and all. So here in this case, what happens? The carbamazepine interacts with the cytochrome P450 enzymes in the liver. They will induce the enzymes, and the cytochrome P450 enzymes will quickly metabolize warfarin. Warfarin will be metabolized quickly, and warfarin dose will be decreased in the serum. Serum drug concentrations will be decreased in the patient, and these may cause subtherapeutic dose, and it will cause treatment failure. It will cause treatment failure. So one another example for causing subtherapeutic dose is drug interaction. Like this, see, one is directly prescribing wrong dose or low dose, or without calculating the dose, prescribing the drug to the patient, and there may be certain adverse effects to the patient. Drug interactions can be seen. Patient has to take twice daily, but due to non-adherence, patient will take only once. Even that also will go to subtherapeutic range. So all these are different causes for subtherapeutic level. So the subtherapeutic level, what it does, it will fail the treatment for most of the antibiotics and for most of the what we can say hormone replacement therapies for oral contraceptives and all. It is very important for us to maintain the therapeutic levels of the drug. If therapeutic levels are not maintained, particularly for narrow therapeutic drugs, we have digoxin, we have anticoagulants, we have aminoglycosides, we have vancomycin, we have so many drugs for narrow therapeutic drugs. Okay, narrow therapeutic drugs. All these drugs will have risk of causing subtherapeutic doses. So they may cause subtherapeutic level, and it will cause medication error. I think you understood what is subtherapeutic dose, and with subtherapeutic dose, treatment failure occurs, and that becomes the major risk for medication error. Clear, everybody? And next, very important type for medication error is drug overdose. Same like subtherapeutic dose, there is another concept called drug overdose. Here directly, if 15 mg per kg per day is the standard dose for amikacin, if the same dose is prescribed BD, that becomes prescription error. And the nurse doesn't know about the doses. What nurse does? Nurse will take 15 mg per kg per day. For example, if patient's weight is 10 kg and the normal dose is, it becomes 150 mg. 150 mg should be given for 24 hours. But this 150 mg will be given twice daily, and it becomes 300 mg. And this 300 mg becomes overdose, and it will cause lethal consequences. Amikacin is very very powerful agent. It causes nephrotoxicity, it causes ototoxicity, and also it causes neurotoxicity. Very very powerful agent. If anybody is already having acute kidney injury related symptoms, or if they are having polycystic kidney disease or diabetic kidney disease or anything, if overdose of aminoglycoside is given, definitely patient will cause nephrotoxicity, and patient's kidney will fail. And ototoxicity, in here, if anybody has disorder in the cochlear or ear related disorders, and if anybody has middle ear infection, in this already the nerves in the ear are very sensitive. In that cases, if overdoses of amikacin is given, it will cause ototoxicity. So patient will become deaf. Patient deaf ho jayega. And same with the neurotoxicity also. All the overdose of aminoglycosides are large molecules. Okay, these molecules will go and accumulate in the nerves, and they will cause damage in the nerves. With that, they also causes peripheral neuropathy and neurotoxicity. Okay, so this is about overdose or drug overdose. See, for this we can take a lot of examples. Lot of examples we can take, just for making you understand. I'm trying to give only one example. Okay, so there are many other lethal drugs. We have very toxic drugs. Okay, small alteration in the drug can cause toxicity, starting from digoxin. Okay, we have caffeine, we have methyl xanthines. Okay, caffeine, theophylline, theobromine, and all. Even they are having risk of overdose. And aminoglycoside, anyways, we have discussed. Warfarin also can cause okay, warfarin. All these are narrotherapeutic drugs. All these drugs can cause overdoses, okay, and these overdoses can be seen with either drug interaction. They can also be possible with the wrong dose prescription, okay, wrong dose prescription, or it can also be possible during administration. Administration error भी हो सकता है. See, if a nurse has to give an injection. For example, again I'll take amikacin. Amikacin drug is to be injected to the patient, right? Nurse A comes to the patient and she will administer the drug and she will go. She goes for breakfast or she goes to see another patient or emergency mein she goes to another place. And another nurse will come. The nurse will come and she will see the nurse chart. In that chart, it was pending that amikacin drug was not given. Again, what she does? She will again take one more amikacin drug and she will inject. So these nurses can also make mistakes. Patients also can make mistakes. Even dementia, see, patient has to take only one tablet, but patient always thinks that patient has not taken the drug. So her half an hour in every 1 hour, patient will be taking the drug because patient is having dementia, patient is having cognitive disorder, mental disorder. Patient be every time they will be taking drugs. That will again cause drug overdose. So all these things are very important for the clinical pharmacist to overcome all these medication errors and to optimize the treatment. Okay. So this is another medication error which can be prevented. It can be prevented. It can be prevented mainly by keen observation of the clinical pharmacist. Okay. So in hospitals, you see there are so many roles and responsibilities for clinical pharmacists to optimize the treatment. In hospitals, actually, they are not giving importance for the clinical pharmacist. But we have these. See, all these are different factors which will lead to medication error. Who is focusing in hospital? And if any patient develops medication error, who cares? No one cares. अगर medication error भी आया ना, if patient is developing medication error, बेचारे patients don't know that patient is having medication error, and physicians will never bother. If medication error आया, they will try to cover the medication error and they will shift with the another drug. Through 2, 3, 4 days, medication error will be happening. Patient will damage the kidneys or damage the organ, and at the end they will say, no, 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 patient was dead because of the disease condition only, not because of medication. All these things is possible. In most of the hospitals, you see deaths are mainly due to medication errors only. There are a lot of medication errors happening in India. So in all these cases, it is very important for clinical pharmacists to understand. Okay. Next one is drug interaction. See, drug interaction ke bare mein there is a lot of thing to discuss. It will take 1 to 2 hours to discuss about drug interaction. Drug interactions, we have drug interactions in absorption, we have drug interactions in distribution, drug distribution, we have drug interactions in metabolism, we have drug interactions in excretion. All these drug interactions are called pharmacokinetic drug interactions. Okay, and we have separate another type of drug interaction which is called a pharmacodynamic drug interaction. So about drug interactions, it is very lengthy topic, and for a clinical pharmacist, we need to understand the drug interactions. One best example I give. See, for example, a patient is taking oral contraceptive, okay, and along with oral contraceptive, patient is taking phenytoin. Patient is also a known case of epileptic, okay, epilepsy patient is taking phenytoin. And this patient who is taking phenytoin, patient is also taking oral contraceptive. What happens? Phenytoin is a enzyme inducer. So in that case, what happens? This phenytoin induces the enzymes and it will quickly metabolize the oral contraceptives, and patient's oral contraceptive failure occurs. This is one example of drug interactions in the metabolism. Like that, we have so many drug interactions in different pharmacokinetic drug interactions. In absorption also, I'll give you best example. You see, there is a very good broad spectrum antibiotic called doxycycline, which comes under tetracyclines, okay, tetracyclines. Tetracyclines should be avoided with heavy metals like calcium supplements, iron supplement, and all. So when these tetracyclines are given with calcium, iron, and other heavy metals, what happens? Tetracyclines will cause chelation and they will form complexes, and these complexes will not be absorbed properly from the GI tract, and they will cause absorption interaction, and with that, drug will not maintain in the serum. Okay, serum can the drug will be not maintained, and treatment failure can be seen. Like that, drug interaction, there are so many drug interactions. So drug interaction is also one type of medication error, which is prevented by the clinical pharmacist. So to prevent all these medication errors, we need to understand about all these disease conditions. I think everybody are following me, right? Are you all following me? Everybody. Now let me talk about, yes, let me talk about drug duplication. Can anyone tell me what is drug duplication according to you, according to your opinion? Try to interact. According to you, what do you feel? drug duplication is? Yes, anybody? Okay, drug which is okay for a single condition, multiple drugs are given, multiple dosage forms are given. Okay, and anything else? Yes, yes. See, patient is having analgesia. A patient is having pain, and for pain, single drug can be given. For example, see if NSAID can be given, or along with that, single drug can be given. But see, it differs from patient to patient. It differs in condition to condition. If the condition is demanding different drugs, like multiple drugs, in that cases we can give. But in certain conditions where the condition is not at all demanding, but still patient is receiving multiple drugs. I will try to give you one best example. You see, patient is having diabetes mellitus. Okay, and in diabetes mellitus, we already know that patient may have risk of nephrotoxicity. Patient may have risk of neurotoxicity. Patient may have risk of other complications like many other complications are possible unless patient is taking unless the patient is taking proper drug. If patient's sugar is controlled properly, it is not mandatory for the patient to take a lot of drugs. See, for diabetic patients, what physician does, physician will simply prescribe one multivitamin. Patient will be prescribed with sulfonylurea. Patient will be prescribed with insulin. Okay, and patient also will be prescribed sometimes with ACE inhibitor. Actually, ACE inhibitors are the drugs which are given in diabetic patients who are known case of hypertension to prevent diabetic nephropathy. Okay, so all these drugs are preventable drugs. So here, if patient is really demanding the situation, in that cases we can give all these drugs. But here you see, if you go with multivitamin, if you go with sulfonylurea, insulin, already insulin is having high risk of causing hypoglycemia, and sulfonylurea also causes hypoglycemia, and it may lead to severe hypoglycemia, and patient has to face hypoglycemic complication. So here it is not necessary to prescribe different drugs for single condition. Okay, so like that we can discuss many other examples, and these multiple drug uses can cause lethal drug interactions can be seen, adverse drug reactions can be seen, and that again goes to lethal consequences. Okay, so drug duplication is one more medication error, and this type of medication errors also can be preventable, and these medication errors are preventable unless you are knowing all these conditions. Okay, so we can prevent this drug duplication also. And next, there is one more condition called treatment without indication. Patient is having already indication, and this indication is not treated. In previously in first slide I explained you. Okay, so treatment without indication is very another important medication error that can be seen. And next, ADR identification is another very important medication error. See, for a clinical pharmacist, most of the drugs are having risk of causing ADRs, right? Some drugs, for example, most of the parenterals, if we take, in parenterals we have penicillin, particularly penicillin G. This penicillin G is having high risk of causing allergic reactions, anaphylactic reactions. And we have parental iron formulation. Okay, parental iron formulation we have, and we have biological agents. We have antibodies and other biological agents. All these agents will have high risk of causing adverse drug reaction. So in that cases, prior to the administration, we should be careful that if penicillin G is having risk of causing allergic reactions, we should be ready with the preventable medications, like we have to be ready with corticosteroids, we have to be ready with antihistamines. Okay, and if patient has anaphylactic shock, we have to be ready with adrenaline or adrenaline injections to save the patient. So identification of adverse drug reaction is also very important. There are so many types of adverse drug reactions. Even adverse drug reaction is another lengthy topic. In that we have classification of adverse drug reactions starting from A type ADRs, B type, C type, D type. Okay, there are so many types of ADRs. We have bizarre type of ADR. This is bizarre type of ADR, unusual type of ADR, which is seen due to penicillins. And there are some augmented type of ADRs. There are so many examples for ADRs. And see, there are some drugs which will cause what we can say sedation. Simple drugs, some sedative drugs. A patient is alcoholic already, and alcoholic patient is also taking antihistamine. and patient is taking one antidepressant, for example, any benzodiazepine or anything. So if patient takes alcohol, antihistamine, and benzodiazepine, and patient is going for driving, what happens? Patient will sleep due to driving, and patient will have accident, and patient will die. So all these things we have to explain to the patient related to adverse drug reactions. We have to try to limit the drugs which are given. Okay, so all this adverse drug reaction is also important risk that can cause medication error, and these are preventable areas. And many other factors also we have for medication errors. I think I have not included those. I think we'll stop here. I think we have discussed a few basic points about medication error, types of medication error, how to prevent medication error. See, medication error, to prevent all these errors, it is very important for the clinical pharmacist to get updated with the knowledge. Unless and until you are perfect with the drug knowledge, the pharmacological knowledge, and therapeutic knowledge, it is you are not going to succeed in the hospital to overcome the medication errors. So to overcome these all types of medication errors, you should be perfect with the ADR classification. You should know all drug interactions with the drugs, and you should also be updated with all the guidelines. Okay, and different drugs with different formulations you should try to know. Okay, so if you are good at all these drug related knowledge, you are capable of identifying the medication error, and you can save the patient from the medication errors. Okay, so I think I'm tired. Any queries in this medication errors, you can unmute your mic and you can talk to me, and we can discuss other topics also. Bharat. So we will give some time to our students to uh, ask few queries, and we'll end the session in few minutes. Okay.